Brian.
Hey.
My name is Heather and I'm from occupational therapy, and I was referred to come talk to you about your procedure that you're going to be having surgery on soon, because you have an ulnar nerve laceration. Is that correct?
Yeah, the doctor was talking about why I'm getting the numbness, and
Yeah.
not totally clear on how all that works.
Okay. So my first question for you is, what is your occupation?
I'm an auto mechanic, so working up overhead all the time.
Okay, so a lot of twisting and bending and things like that.
Yeah, and it's really started from doing that kind of stuff.
Okay. So I have a handout here that we're going to go through. So I'm just going to kind of go through it here with us.
Okay.
And so first, we're just going to first talk about real quick what your ulnar nerve is and where it is at. Your ulnar nerve starts in the neck, right here, and it's going to go down and through, but it goes on the inside of your arm.
Okay.
And it goes right into that soft spot of your elbow, down into through your wrist, and into your fifth and your fourth finger. And it's actually half of the fourth finger, so it's on kind of that medial side, meaning the side towards the bottom.
Okay.
And if you hit your arm really hard, your funny bone, that's because you actually hit your ulnar nerve. So that's your nerve right now that is damaged. And so that's probably why you're having a little bit more of that tingling and that numbness feeling. That I always say the funny bone is not a funny bone, but you're feeling that probably more consistent right now.
Yeah, it's really easy to make that hand go to sleep, basically.
Yeah. So how you get that is with being an auto mechanic, you're probably doing a lot of repetitive motion and overuse of your arms, especially being in that upper, above your body. You're constantly doing things, you have that repetitive motion, so you're building things up, so those muscles are actually pushing against your nerve. And you actually had a laceration, which means you had a cut. So recently you must have had an accident that actually caused the nerve to be cut. So that's why they're going in to surgically fix that.
Okay.
So with that, do you, he talk about kind of what to expect with the surgery or what to expect after the surgery?
Not super clear. I mean, kind of went over really important to get it, or I'm not going to get that feeling back really, but
Okay. Yeah.
how long is this going to take to heal up, and
Okay.
what do I need to do?
Okay. Very good questions. And I know when they go through things, and just like when I go through things, it will feel overwhelming. So that's why the handout will be helpful. And we'll go through the handout kind of at every session and just kind of let you know where you're at for your progress. It will be helpful that way, I think. Just
Okay.
kind of let you know. So you're going to be in a splint. So the first up to 14 days, you'll be in a loose cast. So they'll put you in a 30 to 45 degree flexion, and then you'll have the wrapping around it because they know your arm and your hand is going to swell with the inflammation due to the trauma to that site with any surgery. And then as that goes down and you're stabilized, they'll put a compression sock on your hand. And what that is it's just like a really nice tight fitting glove. But it will be more from your finger, like your knuckles here, your MP joints, down to your elbow. So it's going to be kind of a protective gauntlet, so to speak.
Okay.
And what will happen is you'll be put into what's called a dorsal, I want to say it right, dorsal blocking splint. And what that does is it's going to keep you in that, like I said, 30 to 45 degree angle, so you can't go farther down and you can't go farther up, because it's going to keep you in that spot to keep that nerve in a laxed position as best as they can. In therapy, we'll be able to do some things like scar mobilization with you, work on some sensation techniques, because as you know, when anything gets damaged to a nerve, that's where we want to get that sensation back. And so that's why we will work with resensitizing those nerves as it's healing. But you might feel some pin prickling, some kind of that burning when your foot falls asleep and you have that burning feeling. You'll have that because that's part of that nerve as it's healing.
Okay.
At your 4 weeks, we're going to start taking it from that 30 to 45, and we're going to go down to 20. At 5 weeks, we're going to go down to 10%, so it's a gradient. We're going to lower it down, and then finally at 6 weeks, you will get to remove the splint. And at 6 weeks, that's when we'll start doing more range of motion, starting with some passive range. Passive range means that either your right hand will be doing all your motion, or one of the therapists will work with you and kind of help move that around, making sure we get the nice movement going on without the pain. You will have, I always tell people there's muscle acheness, where you're getting achy. That's the pain we want. We don't want the burning, the kind of the stabby pain. That's not the pain we want. We want the soreness, like I just got a good workout pain.
Okay.
Okay. But with that, taking, even if it's Tylenol, over-the-counter medications, if you're having pain, you can work on some hot packs or ice packs, depending on what's more comfortable for you. We might even look at trying some essential oils, maybe trying to work on different techniques with you. We could also work on ultrasound or e-stim, and what that is it's just different ways to help stimulate the nerve to calm it down. Okay?
Yeah.
We'll also work on some strengthening, even just having you turn this way and work on opening and closing your hands against gravity will help actually just kind of build those muscles up. You'll have a hand exerciser and lots of things to follow up at home.
Okay.
Yes, you have another question?
Ultimately, how long do you estimate I'll be down?
Well, so with your job in particular, you're going to have to kind of talk with your actual employment, but at 8 weeks you should have free reign at everything, but it's going to take up to 3 months to fully gain back all that muscle.
Okay.
And just keeping up with those exercises, just because again you want to make sure that you're really staying up, but it didn't happen overnight, so it's going to take a little bit to get that back.
Okay.
So some of the other things to think about for safety is really making sure again that you're watching the edema, which is that swelling in your arm. So at night, maybe having it up on a pillow to help with some of that reducing of the swelling. And you could look at just how you're sitting and making sure you're not hitting that nerve on your elbow too, because if you hit that funny bone area, it's going to shoot pain into your hand too. We want to avoid that.
Okay.
The other thing too is just making sure with wearing the splint, we want to look at your skin, making sure that there's no pressure sores or any little nicks or things that you could be having. If water gets inside there and your skin kind of gets wrinkly, things like that. We just want to make sure that your skin stays healthy for you as you go about your day too.
Okay.
You can do all full motion at the elbow and at the shoulder, so keep moving that around, so it's still doing everything, just no weight bearing until we're able to get that solely up there after that 6 weeks.
Okay.
Okay?
Yeah.
So you should have a full recovery. Usually they don't have any concerns. There is always a 10%, they say, but I think you're young enough and healthy enough that they should be able to, as long as we follow your guidelines and everything, I think we'll be able to get a full recovery.
Good. And then after surgery, how soon will I be seeing you guys?
You'll probably see us within the first couple of days, just because again we want to make sure that splinting's correct and that everything's set up in that right positioning. And then after that, we'll kind of set it up and see how things go from there. But we really want to make sure we get everything set properly so it allows that to heal.
Okay.
Okay?
Perfect.
All right. Well, thank you, Brian, and I look forward to seeing you next week. If you have any questions, give me a call or you can shoot me an email, okay?
I appreciate the help. Thank you.
All right. Thank you.
Bye.